This urinary catheter video guideline is brought to you by the Clinical Operations Council of ACE Physicians and Evidence Care.
The goals of the guideline in this video are to implement evidence-based practices for the utilization of urinary catheters in the emergency department with the aim to improve the quality of care, safety, and cost effectiveness. But first, some background. CAUTIs are a significant source of healthcare-associated infections, in fact estimated to be upwards to 70 to 80% of these infections. And since so many urinary catheters are placed in the emergency department, it is important to focus on this area. This diagram goes through several of the areas in which urinary catheters can be a source of infection, both at the insertion site and the collecting system and through the bag. But even if perfect aseptic technique is used, it's known over time that biofilm will form around these catheters and can be a source of infection, as through capillary action, bacteria can crawl up and enter the bladder and cause urinary tract infections. As a note, this guidelines and these recommendations are based on evidence-based guidelines from the Center for Disease Control and the American Hospital Association. There are three major strategies for achieving success and preventing CAUTI in your emergency department. First is eliminating unnecessary urinary catheters by following what are the appropriate indications, which we will discuss in the next slide, and to do so by having formal orders with approved indication integrated into your electronic health record system. Another best practice would be the use of condom catheters, as well as the use of bladder scanners for presumed retention. It is certainly the second and as important technique and process is to assure aseptic insertion, proper securing of the urinary catheter, proper positioning and maintenance of a closed collecting system, and we're getting better at doing this all the time, and the manufacturers are helping with better kits and better education. But finally, monitoring urinary catheter utilization and making sure indications are being followed and that best practices for insertion maintenance are being followed. This is a listing of the appropriate indications as provided by the CDC, and we'll go through them rather quickly. So, acute urinary retention or obstruction, number one. Number two, accurate measurement of urinary output in critically ill patients. So, any ICU level patient, you need urinary output or temperature monitoring, a catheter could be indicated. And then finally, another step is, indication is, patients required immobilization for trauma or surgery, and that includes spine, pelvic, and hip fractures. In addition, the use of urinary catheters in incontinent patients who have a greater than stage 1, so it's a stage 2, 3, or 4, or any open wound in the perineal or sacral area would be an indication. And finally, hospice and comfort patients. An additional guideline option is available to be customized to your site. This is an example of inappropriate urinary catheter utilization. It's just as important to talk about this because this is what we used to do in the past. So no longer can we just put urinary catheters in because patients are incontinent, because of morbid obesity or dementia and confusion, nor because of patient, family, or clinician's request. And while staff convenience is certainly important and workloads are crucial to what we do in the emergency department, we must balance it against the risk and benefits of urinary catheters. This is an example of the ASEP Choosing Wisely, in which CAUTIs is a high priority item from this campaign. And then finally, just to go through a quick FAQs, you can pause your video at this time and read these, but we'll review them really quickly. Education alone is not going to be good enough, and requiring a hardwiring of your process and formal orders is really the best way to go. We talked about hip fractures, and number two, and yes, they are an indication if someone's not able to use a urinal, not able to use a condom catheter or a bedpan, if they have too much pain or mobility because of such. And then why are we focusing on the ED? Because the CDC and AHA have shown through retrospective analysis that many catheters are placed in the ED and often without clear indication or physician orders. A few notes about these guidelines is that they are chosen to be an accepted pathway when applicable and are not intended to establish a standard of care or replace provider judgment. Each patient is unique. This is an example of a reference document which can be downloaded and printed up for your staff as a flow diagram to highlight the indications and where to go next. This document and other resources can be downloaded from CAUTI Prevention website or from the CDC or the American Hospital Association. Thank you for watching this guideline video. Your feedback is appreciated.